Today, I want to discuss something very simple, very important. You feel like you have an infection, you feel like you've been exposed to something, and you now decide to take antibiotics. The antibiotics you're taking does not necessarily work like that. Let me break it down for you very fast. Antibiotics are drugs that you take necessarily to help you fight a particular bacteria or infection. Now, in fighting that infection, the very good thing that you need to know is what infection exactly you are fighting. You don't just self-medicate because you want to, but you have to self-medicate because you know what exactly that you are fighting. This is the importance of going to a lab to get a test done. That test is important because in the test results, you will be shown the exact bacteria. One, you'll be shown the drugs that the bacteria is resistant to. You'll also be shown the drugs the bacteria is going to fall against. This will affect your choice of drug in general, and this is very, very important because people that have been taking one particular brand of antibiotics time and time and time again, most times when they have a particular infection, it's very, very possible for the bacteria to grow immune to that drug and cause a problem for you because it means that anytime you take the drug, you're basically wasting your money. So, in order not to waste your money, go to the lab, get some checks and some tests done, and find out the drug that you need to treat a specific type of bacteria and let it be treated. Because the amazing thing about your body is that your body works in a very funny way. Sometimes you get used to particular things. The way we get addicted to some level of drugs and some substances that makes it possible that when you take them, the particular dosage you took before is no longer enough. In this case of antibiotics, the bacteria gets used to the medication and it's no longer effective against it, making you feed your body with drugs that necessarily will not do anything to help you in your situation. So please, next time you get an infection or you feel like you're exposed to something, just do well to walk into a hospital, a diagnostic center, or a clinic, get a test done, and simply find out the bacteria that you're supposed to fight and the drugs that it is going to fall to, and take the medication. Lastly, I advise don't take the medication in Nigerian way. You take in the morning, you take the next day, you take 3 days later, and say I finished the drug. No, when you're taking antibiotics, you try as much as possible to follow it religiously. If the dosage is once per day, you take it one time per day. If the dosage is one in the morning and one in the evening, you do such. Thank you.